As I mentioned earlier, our favorite doctor is in the house, Dr. Jill Vilaythong with St. Mary's, and we appreciate Dr. Vilaythong joining us this morning. Looking real, you're playing the part on the colors.
Thanks for having me again.
It's good to see you again. And our theme this morning, Doctor, as you know, is breast cancer awareness. So we want to kind of have a tag team effort. But again, thank you for being here with us this morning.
Thank you for being here, Dr. Jill. It's an honor to have you here this morning. My first question is kind of like two questions in one, so I'll start with the first one, or the first part of that question. I'm sure many of our viewers are curious about this, and I don't think a lot of people know, but do men get breast cancer as well?
Yes, breast cancer in men is very rare, but it does happen. The total breast cancer diagnosis in men is about 0.5% to 1% of all the total breast cancer diagnosis in the U.S., but it does happen. It is more common, as we all know, in women. It's the leading cause of death in women worldwide, and it's the second leading cause of cancer death in women in the U.S.
Okay. Wow. Very good, very good. You actually answered the second part of that question, the numbers regarding that situation with the men.
I guess when it comes to all health issues, it's important that you see a doctor not once every 20 years, but you really need to have the annual checkup for men and women. And probably women are probably more committed to that process than men. You know, men are kind of tough and they just kind of go through it, or I'll feel better tomorrow, and then they find themselves 5 years later dealing with something. But on the theme of breast cancer, Dr. Vilaythong, what are the types of screening, and what can we do personally in regards to screening? Are there self-exam kind of stuff, or how do we get going in this screening process, I guess?
Right. The most important thing is to establish your care with the doctor, and you can discuss with your doctor the best screening tools to screen for breast cancer. You can also discuss the risk and the benefits for these tests, and you can discuss when to start screening. And so together you can make a decision of what the best breast cancer screening strategy would be for you. The most common screening tool for breast cancer is a mammogram, which is a special kind of X-ray that can detect breast cancers early. And the main benefit of a screening mammogram is that, again, it can help to screen breast cancer earlier, and in that way, may be easier to treat. And this helps to prevent deaths from breast cancer.
I'm sure folks that are watching this morning could be from age 20 to 80. So when you said the screening of the mammogram, is that once every 10 years? I mean, is there a standard recommendation that you would say, okay, this is what you should consider?
Right.
Not every year, but I'm sure it's...
I think, there's a lot of expert opinions on when to start screening, so it varies, but generally most experts agree that you should start screening around the age of 40 to 45. And, the screening, most experts say screening should be annually with a mammogram when you're 50 or 55 or under. Some say every 2 years. But again, this can be decided between you and your doctor. We continue to screen routinely for breast cancer for as long as you're healthy, and if you continue to have at least 10 years of life expectancy. I also do recommend that women become familiar with their breast by doing self-breast exams. In this way, you can kind of detect any changes, any unusual signs and symptoms, and then you can call your doctor. Even though self-breast exams don't prevent cancer, I think it helps women to understand the changes that their breasts undergo, and also to help identify any abnormal signs and symptoms.
Thank you.
Very good.
What are some ways to remember to have a mammogram or exam? Can you give us
a lot of women or a lot of patients, they will schedule their mammogram around the time that they see their doctor, which is every year, or some women like to have it at certain times of the year, such as around the time of their birthday, and that helps them to remember.
Perfect.
Kind of like your driver's license, and you need to be paying attention to your license at that time. For an individual that may not have a primary care physician, they're maybe new to the area, or they just do not see a doctor on a regular basis, what are your recommendations, and what are some options here in Oklahoma and also here in Northwest Oklahoma to find a doctor, or if they don't have insurance, but they have put this off? What are some recommendations for that category of individuals?
So fortunately, there are some resources for people who may not have insurance, who have a low income. There is a project in Oklahoma called the Oklahoma Woman Project that actually offers coupons to women to help pay for mammograms, and if you qualify based on your income and your financial status. There are a few clinics in town that actually offer these coupons, one of them being the Enid Community Clinic, which is a free volunteer-based clinic, which I myself, as well as several of the doctors in town, volunteer at. They also have volunteer nurses.
Excuse me, because there's probably that percentage of women that just put it off because of no insurance, or they don't know a doctor. It's the financial issues.
Right.
And it's good to know that there are these avenues.
Right. So. There's another clinic called the Great Salt Plains that also offers these coupons, and so there are resources. I think the best thing is to get in contact with the doctor, and they can help guide you through this and point you to resources.
You mentioned several resources here in town. Is there a local contact number to learn more about these resources that you can provide?
Right. The St. Mary's Women's Imaging, they do the mammograms for St. Mary's and also for Enid. They offer information on breast cancer information as well as resources, so that's a good local contact. There are also, there's the American Cancer Society. It's a national organization, but there are also 2 local offices in Oklahoma which you can call and get information about breast cancer and resources as well.
It seems like the month of October each year is that designated breast cancer awareness. You'll even see in high school football, football players with pink socks or pink gloves, and professional football and sports in general are doing something to raise awareness about that. Is there anything that we really not avoid talking about, but we just don't address when it comes to the conversation about breast cancer awareness? Is there anything that we're missing when we're trying to raise awareness of it, but is there something that we're missing in regard to breast cancer awareness? I mean, it's not respective of any person. You know, it can happen to someone in any state. It's a global thing, as you said. Is there anything else about breast cancer awareness that we just don't discuss?
I think, what I find is...
Put you on the spot, I'm sorry.
I think when people don't get their maintenance exams or see the doctor, I think there's a lot of fear in what they don't know. And I think it's important to have that conversation with a doctor or with a trained medical person who can give information. And I think that, hopefully that will make it easier for people to access this care, or maybe to even get the courage to get screened. I think there is a lot of fear and a lot of not knowing what's out there, what are the risks and the benefits with the screening mammograms with breast cancer. And so I think people, hopefully they, with the information we provided, they can have access to information.
Yeah. This question may really put you on the spot, but since the last several years, this emphasis in October on breast cancer awareness, do you know if it's made a difference, this effort to just raise the awareness, get the mammograms, get a primary care physician, go to a clinic, whatever? Do you think overall health has increased for women because of this emphasis?
I do. I mean, if you look at the numbers, the death rate from breast cancer has decreased from the 1980s, and part of that is better screening tools, but also better treatment. And so I think it has made a difference.
Okay. Sarah, anything else? I was kind of taken over there in the last couple of questions. Anything else comes to mind?
No, nothing. You've covered everything. Thank you for all the information you've given us this morning.
Thanks for having me.
And again, the number that you can learn more about breast cancer awareness, 580-249 and 3770, I believe. So the doctor's in the house at the round table this morning, our special friend, special guest, who also does the medical minute for us from time to time, Dr. Jill Vilaythong. So Dr. Jill Vilaythong, thank you for being with us. We always appreciate your wealth of information, and thanks for keeping us all healthy today. So hopefully we'll take this information and go forward.